And in this final kind of 48-hour window, I want you to focus in on your clinical reasoning. I want you to really focus on showing your conveying of knowledge, show your clinical reasoning, even if this means talking out loud um, your thought process so that the person assessing you can kind of follow you on that journey of how you're thinking and how you're communicating. Yes, it's an artificial setting. It's not what you would do in normal life, but sometimes going that extra step and kind of verbalizing your thought process might get those marks out where you might be thinking it, you might be doing it in clinical practice, but if you're not saying it, sometimes it's hard for the assessor to know that you've ticked that box there. So, just something to think on for these final 48 hours. Now, of course, this exam really is about your communication skills. The AKT and the KFP exams are showing your clinical knowledge. This is in that knowledge transfer, that knowledge conveyance, and it's that final kind of safety check, really, for lack of a better way of putting it, to say, are you ready for independent practice as a consultant general practitioner? Now, of course, try and avoid jargon when explaining conditions and treatments. Now, this is particularly important for the case encounters. So when you're actually with a sim patient, it's showing can you actually convey knowledge to a patient in a way that they're going to be able to understand. The asterisk is there because in the clinical discussions where you're actually talking to a clinical assessor, a peer, I want you to be using a bit more of that jargon there or conveying that more consultant level knowledge using language respected for your station. Now, the asterisk is there because if you don't know the fancy word for something, you can just say it as you would explain it to a patient. Because ultimately, we know that you have that knowledge. Those other two exams have kind of paved the way for that. Feel free, if you are uncertain, to just use what you would say to a patient to convey that information there. Again, in these last 48 hours, review those common scenarios. Think of the things you see day to day, because there's going to be flavors of that through the exam as well. Again, they're not trying to trip you up for this exam. They're trying to give you a few things that you've probably encountered before, maybe with a few twists there to just challenge some of those critical decision-making skills, but they're not trying to make you stumble over your feet. Have a good working knowledge of relevant guidelines. So your CKD management guidelines, COPDX, heart failure guidelines. If you're going to spend whatever time is left to kind of flip through things, these are the things I'd probably recommend you go through. Of course, the RACGP Red Book is a wealth of information that you should be familiar with, and so a great place to actually have a read through if you want to be doing any more reading at this point in time. But of course, you may want to just spend this last little bit of time on self-care. If you can, I know at late notice, tell me about it, but try and take tomorrow off. Have Friday free, rest, ponder, just think through things. Don't necessarily be sitting there with textbooks. Just think through in your head. And if you have a particular question you want to answer, by all means, look it up, but try not to cram information into your head at this point in time. And of course, if nothing else, tomorrow night, definitely get an early night. Go to bed early. Make sure that, if you've got kids, that don't sleep, go to bed early so that you have the best chance of getting as many hours sleep as possible. And I feel you.